Adrian. So our young fellow, we have Justin, who's a 21-year-old who came in for his first severe asthma attack. So he is now stable and he's ready for discharge. I thought this would be a great teaching opportunity for you to give him some counseling around the use of an asthma inhaler, a preventer, and a spacer. So what I'd like you to do is I'll come in with you, but I would like you to explain how a reliever works to the patient, how the preventer works, and to show him how to use the reliever, which is the same way as the preventer, and also explain any side effects that they can expect from the medication, and how to use a spacer and look after it appropriately as well. And also what to do in future cases where they might not feel well and not responding to their puffers. Does that all make sense to you?
Yeah.
Okay, shall we go in and eat?
Hi Justin, my name's Adrian, one of the medical students. I was just asked to sort of explain to you what asthma is and how to properly use the inhalers.
Thank you, Adrian.
Yeah, no worries. Can I just check what's your understanding on inhaler technique, and have you ever used an inhaler in the past?
Yeah, I've used an inhaler in the past, but to be honest, no one's really explained to me what an inhaler actually is or how to use it. So I don't know, I've just been kind of winging it most of the
Okay,
time.
yeah, we're happy to help. We can definitely explain the whole process of how to use an inhaler, as well as a spacer. Just quickly checking.
Never heard of that.
Never heard of a spacer? That's all right. We'll start with the inhalers. There's two types. There are preventers and relievers.
Yep.
So this is an example of a reliever medication. Its proper name is Ventolin. So you use a reliever inhaler when you have symptoms. So how you use it is you would open up the cap like this. So like this. If this is the first time you're using the inhaler, you need to prime it twice. So you hit it twice. Exactly like that. Now, without the spacer, how we'd use the Ventolin would be to have a firm sort of grip over sort of the pocket here, spray and inhale at the same time, and hold your breath for 5 seconds, and then remove the inhaler and just breathe normally.
Yep.
So because that's quite tricky to manage, especially when you're sort of short of breath, we recommend using the spacer. So the spacer is just a device that sort of helps with delivering the medication where it needs to go, which is in the lungs and not in the back of the throat. So with a spacer, the technique is to put the inhaler on the one end of it, make sure it's still firmly in there. And it's the same deal. We want to get a firm sort of grip with our lips around this sort of the mouthpiece on this end, and we'll offer maybe 1 to 2 sprays within the spacer itself. And once you have your mouth around the mouthpiece, just breathe in normally 4 times.
So in and out.
Yeah, just a normal in and out sort of tidal breath. And after that, you can just relax and breathe normally from there as well. Does that make sense?
Yep, so breathe in and out normally 4 times.
Yes.
And then you can take it out. Okay,
exactly.
cool.
So that's the technique for both a preventer and a reliever.
Yep.
So just going back to what they do. So a preventer medication like this one, we use it during the symptoms. There are some side effects that come of it. You can get sort of faster heart rhythms, maybe a little bit sweaty and clammy. If that's the case, it might just be a case that you might want to go to your GP and just arrange changes in doses. But just to let you know, that's quite common side effects of a Ventolin sort of inhaler. Now the preventer, which looks similar but might be a different color, perhaps orange, that's a reliever medication. So we would use that sort of regularly every day. So that prevents asthma attacks from coming on. Depending on your sort of recommendations, it's either 2 puffs or sometimes even more. A certain time during the day that we recommend also using the spacer. Now, because the preventer is a steroid, it can increase the risk of infections. So we recommend sort of rinsing your mouth quite thoroughly after you use the reliever, use the preventer each time that you do it.
Yep.
Yep. Does that make sense as well?
Yeah, just a quick question.
Sure.
So if I'm feeling well and I haven't had an asthma episode in a while, do I still have to keep using the preventer?
That's a great question. So So that will be down to sort of GP follow-up and a conversation with your GP to see if perhaps you could stop using the reliever. However, given that you just recently had a quite severe asthma attack, we normally start with, I guess, a lot of medications, just so that you're sort of well managed from that point. And over time, we can decide on whether we can stop some medications.
Okay.
Great. Now, just speaking on the spacer itself, so recommend washing it maybe once a month, just with warm water and sort of soap or detergent. But we do recommend also drip drying it and not wiping it down with a cloth. That's because it can introduce static and affect the delivery of the inhaler and preventers as well. Great. So with all these medications, they're fantastic. They prevent and relieve symptoms when they come. However, there might come a time where you have another severe asthma attack. Hopefully that does not happen, but if it does happen, recommend that you first try sort of asthma first aid, which is 4 puffs of the Ventolin inhaler into the spacer. We do it twice with 4-minute interval between them. If that still hasn't resolved any symptoms, or you feel unsteady and unwell beforehand, recommend calling the ambulance on 000 and getting yourself to ED for so that we can manage you from there.
Okay.
Does that make sense?
Yes, it does.
But otherwise, if it's self-resolves with 2 puffs, then we're happy for you to not come into ED, but perhaps go to your GP just to let them know that you had more asthma attacks recently.
Yeah.
Does that make sense?
Yep.
Great.
Cool. Thank you.
Okay. Any questions?
No, I think you answered most of my questions.
Brilliant. Thank you very much. So we'll give you an asthma action plan as well. That's just basically to reiterate what I've said, and also organize the GP follow-up.
Right. Okay. Cool.
Brilliant.
Thank you.
Thank you, Justin.
Go.
All right, Adrian. Now that we're out of the patient consult, I was in there watching you do it. I didn't want to interrupt. I think it went very well, but before we get on, I would like to give you some feedback. Is that all right?
Absolutely, that's fine.
Okay, so how do you think that you went?
I think I went okay. I got most of the information that I needed to get through to the patient. I think I did a good job sort of checking understanding throughout.
So what would you say you did well?
I think it's just having a sort of structured format on what the education was about, and again, checking in regularly with the patient just to check for understanding and see if they have any sort of additional questions throughout.
Anything else that you'd like to add?
I think, I guess the content on it, hopefully it was sort of flowing and not sort of all over the place, I would like to think. And I think that might have also helped in this consult.
Okay. I would just like to discuss a few points that I would also think that you did really well. So I agree with everything that you said. You had a very structured approach, and you're very empathic with the patient, understanding where they're coming from. And I really especially liked how you involved their understanding by checking on them frequently. I think you did a really good job at explaining how the medication works, how it needs to be used, how both the inhaler was demonstrated was very well done, and also how to look after and use the spacer was very well done as well. I especially liked the way you safety netted, letting them know what to happen in the future if they had a severe attack, and to keep up and follow up with GP as well. And also I think the parts where you discuss the side effects of the patients were well done as well. And just moving on, I would like to ask you, are there any parts that you felt you didn't do as well?
I guess there were some points where I stumbled, especially handling the actual inhaler and the spacer, particularly with removing caps and getting it going. I feel like that didn't flow as well as I would hope. So I guess that would just come down to more practice and more consults with patients explaining stuff. Yeah.
Okay, and I do appreciate you sharing that, and you are very much right. You might have learned a lot about this in medical school, but some of these practical things might just be a bit fidgety at the start, but I do agree. Some points I think that you could work on that went a little bit less well. so when you did mention the using of the Ventolin, it was just a little bit confusing on how you mentioned them to wrap their mouth around here. So I would say put the mouthpiece, take the cap off, put the mouthpiece tightly around your lips, and that just could have be done a little bit better. Another thing is I wrote down that you did mention the use of the spacer, but you could have also added the point. The main reason why we use the spacer is, yes, for medication delivery and not to end up with most of the medicine in the back of the throat, which can happen with the difficulty associated with using that, but also it can actually increase the amount of medication that ends up in the lungs. So emphasizing the use of a spacer is good because it actually improves the amount of the medicine getting in. So that could have been done. Another thing that I would also recommend that you do emphasize and remember is whenever a patient uses this, to often check for the expiry, because an expired medication is probably not going to work as well. So informing them to check the expiry is something that you could do a little bit better the next time. And otherwise, I thought you did really well, and you didn't leave much. As I was sitting there and observing you, I didn't think you left much for me to really inform the patient about, and everything was done quite well. So do you have any other questions about what we did?
No, I think that's, thank you for the feedback.
That's fine. Whenever we get a patient like this again, I would love to get you to go back home, do a bit of reading, and we'll get you to practice this one more time, doing some of the small things that we talked about just now, and I'll get you to keep practicing that. Is that something you're comfortable with?
Happy for that.
Awesome.
Thank you so much.
All right.